This topical cream is used to treat certain skin infections. It contains neomycin, an antibiotic that stops the growth of bacteria, and fluocinolone, a corticosteroid that reduces swelling, itching, and redness of the skin. It is important to note that this medication only treats bacterial skin infections and will not work for other types of infections caused by fungi or viruses. It is crucial to use this medication as prescribed to avoid decreased effectiveness. The daily dosage and optimal timing should be determined by a healthcare professional. This medication is to be used only on the skin. Before applying, make sure to wash your hands. Clean and dry the affected area, then apply a thin layer of the medication and gently rub it in as directed by your doctor, usually 2 to 4 times a day. Remember to wash your hands after applying, unless you are treating your hands. Do not cover or bandage the area unless your doctor tells you to. Also, do not use more of this medication or use it more frequently than prescribed. Using it more often or for a longer period will not make your condition improve faster and may increase the risk of side effects. It is not recommended to use this product over a large area of the body or for longer than 1 week unless directed by your doctor. Avoid getting the medication in your eyes, mouth, or nose. If this happens, wipe off the medication and rinse thoroughly with water. For the best results, use this medication regularly at the same times each day. If your condition does not improve after 1 week, be sure to inform your doctor. When using Neo-Synalar 0.5%, 0.35 base, -0.025 topical cream, you may experience burning, irritation, or dryness of the skin. If these effects persist or worsen, it's important to notify your doctor or pharmacist. It's also important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. While many people do not experience serious side effects, it's important to be aware of the potential risks. If you notice any serious side effects such as stretch marks, skin thinning or discoloration, acne, unwanted hair growth, or small red bumps on the skin, it's important to consult your doctor right away. In rare cases, prolonged use of this medication may result in other types of skin infections. If you notice any unusual skin symptoms or if your condition does not improve, contact your doctor. It's also important to be aware that in rare cases, this medication can be absorbed into the bloodstream, particularly in children or when used over large areas of the skin for a long time. If you experience unusual tiredness, weight loss, headache, swelling of the ankles or feet, increased thirst or urination, or vision problems, it's important to notify your doctor. While serious allergic reactions to this medication are rare, it's crucial to seek medical help immediately if you experience symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not listed, it's important to contact your doctor or pharmacist. Before using Neo-Synalar 0.5%, 0.35 base, -0.025 topical cream, make sure to inform your doctor or pharmacist if you have any allergies to neomycin, fluocinolone, aminoglycoside antibiotics, or any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other issues. Also, be sure to inform your doctor or pharmacist about your medical history before using this medication. Do not use this medication to treat an infection in the outer ear canal if the eardrum is torn, perforated. Long-term use or using over large areas of skin may make it more difficult for your body to respond to physical stress. Before any surgery, emergency treatment, or in case of a serious illness/injury, inform your doctor or dentist that you are using or have used this medication within the past few months. Although unlikely, long-term use of this medication may temporarily slow down a child's growth. Make sure to see the doctor regularly so your child's height can be checked. If you are pregnant, use this medication only when clearly needed and discuss the risks and benefits with your doctor. It is unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. When using Neo-Synalar 0.5%, 0.35 base, -0.025 topical cream, it is important to be aware of potential drug interactions that could impact how the medication works or increase the risk of serious side effects. It's essential to keep a comprehensive list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial to consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Neo-Synalar 0.5%, 0.35 base, 0.025 topical cream. If this medication is ingested, it can be harmful. In case of an overdose with serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention. You can contact the Poison Control Center at 1-800-222-1222 for U.S. residents or a provincial poison control center for Canadian residents. It's important not to share this medication with others. This cream has been prescribed specifically for your current condition, so it's not recommended to use it for any other infection unless advised by your doctor. If you forget to use the medication at the scheduled time, use it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and continue with your regular schedule. Do not take a double dose to make up for the missed one. Make sure to store Neo-Synalar 0.5%, 0.35 base, 0.025 topical cream at room temperature and do not freeze it. Keep it out of reach of children and pets. When you no longer need this medication or it has expired, make sure to properly dispose of it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for the proper way to discard this product. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.